I'm Pam Ludwig. I'm the owner of Pretty in Pink Boutique, founded in 2005. We have 4 locations in the Middle Tennessee area: Franklin, 100 Oaks, Hendersonville, and Murfreesboro. And we are a combined business. We are a breast cancer boutique providing all necessary post-surgery items after breast cancer, and then also a compression garment and lymphedema specialist. So we started as a breast cancer boutique in 2005, if you've heard this story before, as a love letter to my mom, who did pass away from breast cancer. My mom did not have lymphedema. She did not develop lymphedema after her breast surgery. My mom, unfortunately, only was with us for 10 months after her diagnosis. So I don't know if she didn't have enough time to develop lymphedema, or maybe she just was one of those lucky ones who was not going to get lymphedema. But as I learned, as we launched this business, Pretty in Pink Boutique, in order to serve all the needs of a mastectomy patient or a breast cancer patient, we did need to start providing upper extremity compression garments, because as some of you or most of you should be aware, that lymphedema can develop after we remove a lymph node under the axilla area, under the underarm, after breast surgery, because surgeons take that part of the tissue in order to determine whether or not the breast cancer has spread. The first place breast cancer will spread will be to the lymph nodes, out of the breast and into the lymphatic system. So what can happen after that procedure is that some women can develop swelling in their arms or hands or truncal area related to that. So we started offering compression sleeves, just simply, again, to kind of make ourselves a full, well-rounded breast cancer boutique. And what we found very quickly is that there was really not a lot here in the Middle Tennessee area for those women who had that swelling issue. So we're actually very, very blessed here in Nashville. We have a number, I want to say 18 to 20 well-qualified lymphedema therapists. These are physical therapists that have specialized training in lymphedema treatment. We're very lucky to have a number of them in Middle Tennessee. And so over the years, we've just started to partner with them, develop relationships with them, and just actually discovered that we really love lymphedema and we really love serving that population. So over the years, we started, lightly just providing compression arm sleeves and compression gloves for those mastectomy patients. And then we started realizing there was a whole different population out there who also had swelling needs in terms of, people with venous issues, simple obesity, burn patients, a lot of reasons why somebody would need to wear compression. So now we see any type of patient who needs compression. We're not just a boutique for women. We have male patients, we have pediatric patients, anybody who would need a garment for swelling. We partner with those physical therapists who order those garments and the doctors who prescribe those garments, and then we provide anything anybody would need for compression. So what is lymphedema? Here we are in Lymphedema Awareness Month. The month of March every year is Lymphedema Awareness Month. And what we want to do is just bring to light what lymphedema is and how it can be avoided and how it can be treated. So lymphedema is actually a swelling condition that occurs when your lymphatic system, that covers your toes up to your head, when your lymphatic system is not working optimally. So this can occur what we call primary lymphedema. You could be born with it, where maybe part of your lymphatic system isn't working properly and it causes a swelling condition in one of your limbs. But mostly what we see around here is secondary lymphedema. Secondary lymphedema is caused by something else, not something you're born with. So around here, secondary lymphedema usually presents after someone has had surgery. So breast cancer surgery, of course, where they have removed axillary lymph nodes, any type of other oncology surgeries that affect lymph nodes in the groin. We can get a swelling condition in the leg after lymph nodes from the groin have been removed. So compromising the lymphatic system then does not allow the lymph flow to work optimally. So when that happens, you get a backup. I like to really do the analogy of a traffic jam. It's like a traffic jam, right? And so when you have a 6-lane highway and all of a sudden we make that highway go down to 3 lanes, we put orange barrels in the other 3 lanes, then suddenly you've got the same amount of traffic trying to get through a smaller space, right? So what happens? Backs up. That's exactly what happens with your lymphatic system. So those 7 lanes of traffic, when those lymph nodes were not compromised or removed, everything's moving and everything's working. But when we compromise, we take those lymph nodes out or we dissect them, we've now made them kind of ineffective to be draining that fluid. So now you got 3 lanes of traffic, same amount of cars trying to get through, and it's just backed up. So what do we have to do in that situation? We have to work it out. We've got to work out that fluid. So that comes in the form of seeing a lymphedema therapist and getting complete decongestive therapy, and of course wearing compression garments after that therapy is complete. Lymphedema is usually not curable. It is a chronic condition, but don't let that deter you because it's completely manageable. I know lots of people who embrace their lymphedema, their need to wear compression garments. As you can see, they come in lots of fun, cute patterns now. People just wear them, as they would any sock, and it's not even noticeable as being any type of medical garment. So you need to follow the program to get that fluid worked out, and then you'll see that you can live a happy life with that. I think lymphedema treatment over the years has certainly, I would say the treatment itself, there's a gold standard of treatment called what we call complete decongestive therapy, which is manual lymphatic drainage massage by a certified lymphedema therapist, along with self-massage techniques that they're taught at home to help manage their own care, and then along with the dispensing of compression garments. So those items, that process of treating lymphedema has not changed. That's still the gold standard in how we want to treat a patient with lymphedema and swelling. What has changed is the products on the market, for sure. There's just a gamut of amazing products out there that have made lives easier for the patient and also for the therapist treating that patient. Also, we're seeing many, many more physical therapists go to get trained for lymphedema therapy, because that's not something that they're trained on as part of their doctorate in physical therapy. It's actually a separate certification. So they can come out of physical therapy school, be a physical therapist, and be certified and trained to treat lots of conditions, but lymphedema is not one of them. It is a separate certification. So they have to go through that, and I've seen more and more of those people show up to the space here. And then also there's now surgical techniques that are being utilized in a lot of the larger cities. So there's still a lot of school of thought about that, a lot of research being done about that. It's just becoming more and more talked about, I think, is the main thing that I'm seeing the difference in lymphedema. We're now talking about it more. Whereas before, I could say to someone, well, we provide lymphedema garments, and everybody says, what's lymphedema? And they call it all kinds of other things. So I think the fact that we're talking about it, it's not, lymphedema has not become more widespread. It's always been there. But recognizing it, naming it, diagnosing it, and treating it has become more prevalent for sure. I would say over the last 8 to 10 years, we've really seen a big change in that. Well, the first piece of advice I would say is get treatment, because a lot of times, especially women after breast cancer, might have a little bit of swelling and think it's no big deal or it's going to go away, but that can really creep up on you. And the arm is tricky because it doesn't necessarily affect the fit of your clothes until it's kind of well progressed. So unlike, your leg swells and your pants don't fit right, your pant sleeve your pant leg doesn't go on your leg properly, and that's kind of harder to detect in a woman. So I always tell somebody, if you feel tightness or heaviness in your arm and the extremity where you had the breast surgery, then certainly let your oncologist know immediately. Any doctor, but certainly your oncologist, they're going to be the most qualified to refer you out to a lymphedema therapist. So I think also a big myth is that people come in here thinking I have swelling, therefore I need a garment. And compression garments, elastic compression garments, do not treat swelling. They just help maintain the limb where it is. So you need treatment first. So when we get somebody who come in with a swollen arm and say, I need an arm sleeve, we refer them back out to treatment to get that swelling reduced. So if they're going through treatment, what I would recommend first and foremost is complete the treatment. Go through the whole process. It may seem like in the beginning it's not making a big difference, but then all of a sudden you'll see every time you go, it builds upon itself, and it will get better and better, and you'll start to notice your arm swelling has gone down, or you can see your ankles again. It makes a huge difference if you just stick with the program, because again, the program is well developed. It's an old program. It's an old protocol. It's well developed. We know it works. So stick with the program. Certainly go find yourself a certified lymphedema therapist. That's very important. They usually have extra letters past their name, but you can always just ask, do you have a certified lymphedema therapist on staff? Of course, you can always come to us. We have a whole list of those people and can find somebody close to where you live. But you want to complete the program. You want to make sure you go with a physical therapist that actually knows how to treat lymphedema. And then you absolutely want to go and get your garments. As soon as you are decongested, as soon as that swelling has gone down, you want to make sure you come straight to us to get your garments right away, because sometimes that can be a process. We have to order things for you. Maybe if you're custom, we have to wait, 10 or 14 days to get those items in, and we don't want you to swell back up in that process. So as soon as your physical therapist says you're ready to be fit for garments, we need you to contact us so we can get you on your way. So here we are in a Lymphedema Awareness Month, which is very fitting to talk about the Lymphedema Treatment Act. So this is a bill that has been in Congress for years. There's been a grassroots mobilization started by a mom in North Carolina whose child was born with primary lymphedema. And when he needed compression garments as a toddler, she had a difficult time getting her insurance to cover that. So she actually has mobilized a national grassroots movement to get an act passed where lymphedema garments are mandated to be covered by insurance. So that actually just passed as part of a larger bill in Congress, but it did just pass U.S. Senate and Congress and is now going to become a bill. So what does that mean for you who has Medicare or maybe an insurance company that doesn't cover compression garments right now? What that means for you is starting in, I believe it's January of 24, as the law actually goes into effect, because as most of you know, when a law is passed, it doesn't become in effect immediately. They have to set an effective date. So in the meantime, between now and January of 24, there is going to be a whole group of people, lobbyists if you will, who are communicating with the Center for Medicare and Medicaid Services to discuss what the pricing reimbursement will be for those garments, talking about how important it is that quality compression garments are provided over, some junk you can find on the internet. So all of those things have to be discussed. They got to sit down around a table and figure out what those reimbursements are going to be. So once they figure that out, we want to make sure we can still be able to provide those quality compression garments to people that will still get covered by insurance. And when that happens, hopefully January of 24, then our Medicare patients will be able to get their garments billed to insurance. So it's a very exciting time in the lymphedema world, and again, a great testament to what literally grassroots, a small group of people that became larger, can make such a difference in making a positive impact on the world. So don't overlook that for sure. How can you find compression garments online? Well, here's the number one thing I want people to understand. Compression garments do not have a regulatory body like FDA, USDA, anything like that. There's nothing out there that is making sure a compression garment is actually the compression that it states that it is. So always just kind of give the analogy, like I could tell you right now my shirt sleeve is 30-40 compression, 30-40 millimeters of compression. We measure compression garments in millimeters of mercury. So I can tell you right now this is 30-40 arm sleeve, simply because I said it is. Nobody out there to dispute that. There's no regulatory body to tell me you can't say that. So that's very concerning. So actually, if you go Google compression sock, put it in Amazon. You want to buy some compression socks. Put in Amazon search bar compression sock. You're going to get over 20,000 hits. If you put in the taskbar, search bar, medical grade compression sock, you're still going to get over 2,000 hits. So you want to be very, very careful that you're always partnering with someone who knows what they're talking about, lymphedema therapist, any certified fitter at Pretty in Pink Boutique, to make sure you're getting quality medical grade compression. We are a preferred Juzo dealer. That's our main compression line that we offer. We do offer a few others, but that's our main product line because Juzo is over 100-year-old company. It has been producing quality medical grade compression for over 100 years. So you really want to make sure that you're getting the right thing, because if you just laid two socks out next to each other, you could see immediately what's quality and what's not. So you just need to be very careful that, because if you get the wrong type of garment, or a garment that doesn't do what it says it's going to do, or it doesn't have graduated compression like a medical grade compression garment would, meaning that the compression's tighter here and it's a little less as you go up the limb. Same with the leg, tighter at the ankle and a little less as you go up to the thigh. If you find a garment that doesn't actually have graduated compression graduated compression, because as I mentioned, nobody's checking if it does, then you could actually harm somebody. You could actually have a garment that's too tight at the upper leg and looser at the ankle, which is the exact opposite of what we want in order to get that fluid to move. So always just really caution people. They'll say things like, well, I found some compression socks online, they're much cheaper. Yeah, because they're not quality medical grade compression garments. And the patients that we see here are patients who need medical grade compression garments. If you are simply just want, socks to, to boost your venous system, or maybe you're a nurse and you work on your feet all day. Sure, there are some kind of lesser quality products that might suffice for you. But any patient that we're going to see at Pretty in Pink Boutique needs quality grade, medical grade compression garments. All compression garments, all medical grade compression garments do require a prescription. Here at Pretty in Pink Boutique, we require a prescription for all compression garments. And again, that's because we could harm you. If we put the wrong thing on you, if we put something on you that the doctor didn't order, you might have underlying medical conditions that we're not aware of. So we do have to have a prescription to make sure that we don't harm you. You could have kidney disease or arterial disease, and all of those things could potentially be exacerbated if we put you in compression garments when you shouldn't be. So for sure, you want a prescription. Also, prescription is what makes it billable to insurance. So Medicare, unfortunately, right now does not cover compression garments. The Lymphedema Treatment Act did pass, and we will talk more about that. But for right now, commercial insurances do cover compression garments. So prescription would allow that to be billed.